Hi, I'm Dr. DaysA, a cardiac surgeon. For over 15 years, my life has unfolded under surgical lights, surrounded by heart monitors and the sound of heartbeats that sometimes fade away, and that I've had the privilege to bring back. I've seen hearts stop, and hearts fight to keep beating. But what impacts me most doesn't happen inside the operating room. It happens outside, in the everyday lives of millions of people. Every week, I see patients whose blood pressure is completely out of control. Some tell me, "Doctor, I exercise, I eat healthy, I take my pills every day. I don't understand what's going on." And when we go over their list of medications, there's the surprise. A pill that seems completely harmless, one they take every morning, is actually sabotaging their health. It's not an illegal drug. It's not some experimental treatment. It's something you probably have in your medicine cabinet, or can buy over the counter at any pharmacy. And the most ironic part? Many people believe that pill is helping protect their heart or overall health. Today, I'm going to tell you what that morning pill really is. The one that could be silently raising your blood pressure without you realizing it. How it works in your body. And most importantly, what you can do to protect yourself. My goal isn't to alarm you. It's to empower you, because information can save lives. The real danger isn't the disease itself. It's not understanding what's truly causing it. So stay with me, because what you'll hear today might just change how you start your mornings. And maybe protect your heart for the years to come. 1. The hidden enemy, morning anti-inflammatory pills NSAIDs. Let's start with one of the most common habits. That pill many people take the moment they wake up, right next to their coffee or breakfast, to relieve back pain, knee pain, or joint stiffness. The famous ibuprofen, diclofenac, or naproxen. We call them anti-inflammatories, and their use seems so normal that no one even questions if they're safe anymore. But what few people realize is that these pills, when taken daily or for long periods, can raise blood pressure, damage the kidneys, and drastically increase the risk of heart failure. Let me tell you about Roberto, a 70-year-old patient. He was active, ate healthy, and walked every day. But he had arthritis in his knees, so he took a diclofenac tablet every morning to manage the pain. One day, while gardening, he suddenly felt dizzy, noticed swelling in his ankles, and had trouble breathing. At the hospital, we found his blood pressure was sky-high, and his heart was in acute failure. The cause? Not his age. Not his diet. It was the chronic use of that harmless anti-inflammatory. NSAIDs block enzymes that trigger inflammation, yes, but they also interfere with substances that help keep blood vessels open and the kidneys functioning properly. The result is a double hit. Keycap 1. The body retains sodium and fluid, which increases blood volume and pressure. Keycap 2. The arteries narrow, forcing the heart to work harder. And to make matters worse, these drugs also blunt the effect of blood pressure medications, meaning your antihypertensive pills may not even work properly. The lesson is clear. If you need anti-inflammatories, take them only when truly necessary, in the lowest effective dose, and always under medical supervision. Don't start your day with a pill that might be quietly making your heart work harder. 2. The false protector, antacids and proton pump inhibitors PPIs. Now let's talk about another very common habit. Taking a stomach protector every morning. Omeprazole, pantoprazole, lansoprazole. Names so familiar that many people see them as part of their daily routine, like brushing their teeth. But here's the problem. These drugs were originally designed for short-term treatments, yet they've turned into a long-term dependency for millions. And while they do relieve heartburn, they can also disrupt your body's balance in ways that raise blood pressure. Let me tell you about Elena, a 68-year-old woman. She had been taking omeprazole every single day for nearly 10 years to protect her stomach. When she came to see me, she complained of fatigue, irregular heartbeats, and sudden spikes in blood pressure. The problem wasn't her heart. It was her magnesium deficiency caused by years of daily use of the drug. Magnesium is like the orchestra conductor of the heart. When it's missing, your heart rhythm goes out of sync, and your pressure rises. And several studies have also shown that these medications reduce nitric oxide, a molecule essential for keeping your arteries flexible. When nitric oxide levels drop, the arteries become stiff, and blood pressure quietly climbs. The takeaway: if you take omeprazole or a similar medication daily, don't stop abruptly, but do ask your doctor if you really need it. Often, small lifestyle adjustments, like eating lighter dinners or cutting back on coffee and citrus, can control acidity without long-term medication. 3. The risk in disguise: morning decongestants. During cold, flu, or allergy season, many people start their mornings with a pill to clear up their nose. Tablets or syrups containing pseudoephedrine or phenylephrine. They work fast, yes, but that quick relief can come with a dangerous cost. These compounds are vasoconstrictors. They narrow the blood vessels in your nose to reduce swelling. But the problem is, they don't just act in your nose. They circulate throughout your body, tightening blood vessels in your heart, kidneys, and even brain. The result? High blood pressure, palpitations, and arrhythmias. Not long ago, I treated Marta, a 75-year-old woman who had taken a decongestant for a simple cold. 2 days later, her blood pressure skyrocketed, and her heartbeat became irregular. All because of a so-called cold medicine. If you're over 60 or have hypertension, avoid oral decongestants. Choose safer options: saline sprays, humidifiers, or nasal solutions with local action only. Never let nasal relief turn into a heart crisis. 4. The supplement trap: too much calcium and heart-healthy vitamins. The fourth common mistake comes from supplements. Calcium, magnesium, vitamins for the heart, or for the bones. Many people take them out of habit, without realizing that too much can be harmful. Calcium, for example, is essential for strong bones. But when taken in high doses through supplements, it can build up in your arteries. Over time, that buildup hardens your arteries, raising your blood pressure and your risk of a heart attack. Your body is designed to absorb calcium slowly through food, from milk, yogurt, spinach. But when you take it as a pill, the calcium spike in your blood is so high that your body can't handle it. And the excess? It ends up deposited in your blood vessels. Remember this: more is not always better. If your doctor prescribes calcium, make sure your levels are monitored, and that the dose is precisely calculated. Even something as simple as a supplement can quietly alter your blood pressure and heart health. Your heart has worked nonstop for decades. Give it the care it deserves. Because protecting it isn't about luck, it's about knowledge and prevention. And if this message made you think, share it. Someone you know might be at risk without realizing it. Sometimes a single conversation can save a life. If you learned something valuable today, don't let it stay here. Pass it on. Hit the share button and send this video to your family, your parents, or anyone who takes daily medication.